Hey guys, Dr. Will here from Miami Spine and Performance. We are back with John. For those of you that watched our video last week, I showed you what a typical adjustment looks like here in the office for a patient dealing with spine and shoulder pain. So today we're going to use our Achedaway muscle scraper. We did a review on this a few weeks ago. This is an absolutely awesome tool. I've been using it with tons of patients. So we're going to get in, work on John's shoulder, and then work on his erector spinae, which are the muscles along his spine that are a little bit tight today. Okay? So as far as the shoulder goes, we're going to go all the way up to the upper trap here. All right, as you can see, this guy's got a little bit of muscle on his back and shoulders here, so we're going to have some tissue to work through, which is why I love having a great tool like this. It also adds heat, so we can get a little more relaxation of the muscle there. We'll go all the way into the mid-back here. All right, so we're going to turn our tool on. You can see I have a temperature in Celsius, and it's already vibrating. So we'll go to the middle temperature here. This thing does get fairly hot, really warm rather. And we're just going to start with some light scraping on the upper trap. Just drop your ear to your shoulder a little bit. So as the tool warms up, we're just starting with some light scraping. The upper trap is maybe more than any other muscle in the human body is the most common thing that I see being tight. Probably 19 out of 20 patients that walk in could use some soft tissue work on the upper trap. You carry a lot of stress there. If you're somebody that works out, does jiu-jitsu, if you don't work out, the upper trap always seems to get tight. Now we're going to come in and work through some of the rotator cuff muscles here, and as they tie into the lat. Let's see, I'm already getting a little bit of warmth there.
Yeah, that's nice.
So we're just going to work through the shoulder blade here. Again, nothing crazy. No need to, bruise the patient or anything like that. As cool as that might look online, it's not always necessary. Just applying some gentle pressure, and really all we're looking for here is just for the muscles to relax. Get a little bit of pain relief, a little bit of heat, and of course we're being specific with where we're targeting, right? So I'm hitting all the different muscles that support the shoulder and everything that could potentially be causing a fixation in the shoulder. Now we'll get between the shoulder blade. If you could, John, give yourself a big hug, please. So now we can just expose a little bit more of that muscle. I'm going to go along the muscle fiber, so we're working through middle trap, lower trap, rhomboids, serratus posterior, for those of you anatomy nerds that might be watching. And we're coming back up into the tine in the upper trap here. We're getting a little bit of reddening there, which is good. Across, and you can go ahead and relax, John. So just if you could just pull your right shoulder across your body like you're stretching the back of your shoulder. Yeah. So now we're just getting a little bit more exposure here of the lat. Go all the way down. We'll add a little bit more of this in here. Doing okay, John?
Yeah, it's great.
You can see the lat actually goes all the way down to there. So this is all lat tissue still. So we're going to stay in here and just kind of go all the way in. So then we'll change our direction. We'll scrape up against the position of the muscle here.
I feel like I'm always tight in here, so this is super nice.
Good. Now I'm going to have you lie on your right side, John.
Okay.
Let me set the pillow up for you. Get all this out of the way. I'm sorry, lie on your left side, please.
Gotcha.
So this is another kind of angle we can get the lat here. So if you could just kind of reach overhead towards the wall there.
Sure.
This is kind of a better way for us to get into the lat here with the tool. Just doing some scraping through here. Again, back to the rotator cuff, posterior shoulder, even up into the tricep. These are all areas that can cause issues in the shoulder, and how, back pain and shoulder pain can work together, right? Because these muscles can all kind of tighten up. Change our line of drive here. This muscle is always a really common culprit here along the shoulder blade. So we'll get in there and make sure that we get nice and deep into this muscle. Perfect. Get into the posterior shoulder here. Awesome. Now go ahead and go face down, please, John.
Sure.
So, as John's laying here, obviously you can get a really good visualization of the muscle tissue, but you can also see what muscles might be working a little bit overtime, right? Right through here, these guys are pretty locked up. And again, this could be long periods of standing, long periods of sitting. This could be due to the jiu-jitsu. It could be weightlifting. There's all kinds of reasons why these muscles get tight, but either way, we're going to go in and try to take care of some of this muscle tightness through here. And again, this is probably why we were feeling some of the joint fixations we were feeling as well when we were adjusting John. So because these muscles are larger, we can get a little bit deeper in here, be a little bit more aggressive than we would be with the shoulder. And we're just going to move along the muscle fibers. So again, because this tool does more than just, apply pressure in the form of the edge of the tool here, it actually heats up, so it warms the area, so we get an increase in blood flow locally because of the warming up of the tool, and we get some vibration, so we get some kind of nervous system activation there. And so we get kind of a 3-for-1 here. So it's like, imagine a hot pack and an instrument-assisted tool and a massage gun all in one. So this is an absolutely awesome tool. It's got this double handle here, so for a bigger guy like John, we can get in and get some depth into our soft tissue work. We're doing a cross fiber massage here, so I'm working perpendicular to the muscle fibers. And then we'll go ahead and do the same thing on the other side, so we'll just go along the muscle, right through there. You can see there's a lot of layers here for us to work through, so we're being, again, a little bit more aggressive with these larger muscles. And again, these are really a common culprit, common thing that we'll see, especially if the joints of the back are locked up. Usually the body will also lock up the muscles. So we want to treat them together. We don't want to send the patient out the door with all this muscular tension to pull those joints back into fixation. So we'll do some cross fiber here. So I'm right up against the spine now, working on some of the small spinal stabilizers. Really trying to affect the nervous system and the muscular system here. There we go. All right, perfect. Go ahead and set up for me, John. All right, so John, first time being treated with the Achedaway scraper. What are your honest thoughts right after treatment?
It was nice. I thought it might be like, those videos where they're like really digging into you and you're screaming.
Yeah.
It didn't feel like that at all. It felt like really nice and controlled. And I feel like I have a little bit of relief right now, and I'm kind of excited to see, like how I can move now.
There you have it. Genuine reaction from a medical doctor in training. He really liked it. Again, it's a very gentle tool, right? So even as I'm applying pressure to try to get into the muscles, he's not feeling like I'm being harsh on his body, or he's not feeling like he needs to tense up. It creates a very relaxing experience, especially because of the heat and vibration. So again, for you clinicians out there, highly recommend the Achedaway scraper. And if you're a patient, try to find someone in your area that works with a tool like this, because it brings great relief. So thank you for watching, guys. Next week, you're going to see me do some ART with John, and then we'll get into some rehab. So keep watching, and please leave a like and comment.